Good day, everyone. I'm very happy to participate in this session and share with you my talk. My name is Bahija Gouimi. I am the founder of AMAL Association based in Marrakesh, Morocco. I'm also the steering committee member of CML Advocate Network representing Africa and Middle East. First of all, let me introduce my organization. AMAL is the acronym of Association des Malades Atteints de Leucémie. AMAL is the first patient group in Morocco and North Africa to support patients with leukemia and other blood cancers. Our mission is providing support to patients and families, improving access to proper treatment and correct monitoring to all patients, raise awareness and fighting cancer stigma in Morocco and in our region, Middle East and Africa, and educating patients and parents by organizing patient meetings, producing educational material, and so on. Advocacy to improve policies and decisions in favor of cancer patients. We have a big project is a patient home, building a patient home for patients and parents living far from the hospital to allow them to be treated with dignity. Collaboration with physician and medical authorities to improve communication and care conditions in Morocco. The COVID-19 pandemic has affected patients and organization and caused major changes to our daily routine. And as an association, we experienced many challenges. The first one is organizational specific changes. We couldn't do any activities. Our activity were suspended. We couldn't sensitize people through working in the hospital on psychological support. We couldn't meet our patients and do our face-to-face meetings and activities that we have planned before. The second challenge is financial resources. We suffered from the lack of funds, no fundraising activities, no grant received. It was a general crisis impacting fundraising efforts. The third challenge is the management of the new situation, how to organize activities virtually, knowing that the majority of patients in our region don't have access to the internet or have issue using the internet. For the first time, we are facing a new context. We are supposed to do more, to achieve more, to do better, and think about security and safety. And regarding our patient home project, we fundraised and bought the land in 2018 and started the construction in March 6, 2020. But we stopped it and have wasted a lot of time due to the quarantine and lockdown. Now, I will talk about challenges and needs among patients. Our patients suffered from drug shortage, no transportation, especially for patients without having a car. Hospitalized were more focused on COVID-19 patients and emergency cases. Doctor only consult urgent or already hospitalized patients because they were very busy at COVID-19 units in hospitals. We suffered from lack of information and misinformation. And the mental impact of COVID-19 was important. Panic, fear, anxiety, and patients were scared to go to the hospital and contact with others, especially with healthcare professionals, which are rightly considered as potential sources of infection. The pandemic had increased financial hardship among cancer patients. This has been a real challenge as many have lost insurance, as well as jobs. Now, Amal responded by taking the following actions. We organized hand cleaning campaigns in many schools since January 2020. We offered liquid soap to schools to educate and encourage kids to clean their hands properly. We distributed also leaflets and educational materials. To face the drug shortage, we implemented a solidarity program called Patient to Patient Support Program. Every patient have donated a drug to other patients, and we took in charge shipping drug to patients with the support of 13 volunteers based in the main cities in Morocco. We organized also webinars with doctors and patients to respond to their needs and question. We had different topics like COVID-19 and cancer, CML and monitoring during the pandemic, psychological support, nutrition, and so on. We also organized regular virtual patients meetings and virtual consultation to allow patients to see their doctors and minimize infection risks. We also participated in many national and international congresses. We distributed uh, 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 a lot of medical masks and disinfectants to patients and parents, especially for those coming in the consultation clinic for the day and coming from remote area, especially to ensure their health, safety, and well-being. And regarding the patient's home, it's now under construction, and we hope to inaugurate it at the end of 2021. Now, I will talk about the key learnings of this pandemic. Despite the challenges associated with the COVID-19 pandemic, many lessons have already been learned. Diseases know no borders, no gender, no race, no language or face. Today it's me, tomorrow it can be you. That's why we must work together to improve patients' life. The world is now global in a way that we never experienced it before. We can do many things differently and virtually. We can study, we can make shopping, we can make congresses, we can consult patients now virtually. It's possible. And life is precious, and solidarity can help to preserve each life. We learned also adaptation and creativity to solve problems. We always have opportunities, even in crisis time. We learn to adapt our activities and our work, and patient learns many things and new things, and also developed their skills. Community involvement is crucial to maintain the sustainability of the organization. And the most important things is the relationships cultivated during regular time help during crisis. And the most important things, we should never waste the crisis. The crisis should never be wasted. In the end of my presentation, I want to share with you some photo of our activities in this period. You can see volunteer distributing mask, disinfectant in the hospital, in schools, some leaflets, and also for kids, liquid soap in the hospitals. And you can see webinar posters also. And I would like to thank our sponsors, our board members and the volunteers who participate actively during the pandemic. Thank you for your attention, and I wish you a successful conference.